Hi, my name is Megan Cagle. I am going to introduce you guys to interventional radiology and a patient care during chemoembolization. The objectives for this presentation are for the student to successfully pass a post-test by defining chemoembolization, explain the nursing assessment in each phase of the procedural care for this patient, recognize contraindications for the procedure, and also identify the signs and symptoms that are reactions to chemo, demonstrate radiation safety precautions, and the correct PPE used for chemo drugs during the procedure. The goals for the students should be to understand what chemoembolization treatment therapy is, learn the signs and symptoms that are reactions to medications, comprehend assessments of the patient in the different phases of procedural care, and appreciate the significance of radiation safety. My purpose for this is to provide interventional radiology nurses with knowledge to apply safe and effective care to the patient undergoing a chemoembolization procedure. This is a very rare process. Not many nurses or even physicians are aware of this type of treatment. So let's get started to talk about what is chemoembolization. Chemoembolization is defined by Stanford Healthcare as, and also it's called a TACE. It's a transarterial chemoembolization, which is a minimally invasive treatment for liver cancer that can be used when the tumor is amendable and the treatment is by surgery. So these patients are not eligible for a resection of the tumor within their liver. It specifically treats hepatocellular carcinoma. This type of cancer is a very aggressive tumor, and it usually arises in an underlying chronic liver diseases in most cases. The preferred treatment for this type of cancer is actually the resection of the tumor. However, the type of therapy that we're talking about is patients that are ineligible for that. And most will do the tumor because of the extent of the underlying dysfunction of that liver. The only curative treatment available for these patients is actually a liver transplant. So when we're talking about this therapy, it's not a curative treatment. It is palliative. It's just trying to prolong these patients in order for them to live long enough to arrive to a point where they can be on the transplant list and receive that transplant. So a TACE. What are we actually doing? Chemoembolization is when an interventional radiologist actually mixes a high-dose chemotherapy with embolization particles. And what's actually happening as the IR physician is embolizing the arteries that feed that tumor. It's very similar to a uterine embolization when we treat fibroids, except in this case, we're using chemo with it. They use fluoro, which is an X-ray, and they actually guide wires with inside of the artery system to the tumor, and that's how they determine where they are. They mix the chemo drug with contrast inside of that so they know exactly where the contrast is being injected. That's how we can see it on the fluoro screen. And most often used to treat patients with unresectable hepatocellular carcinoma. So this is basically a bridging therapy for those patients on the transplant list. There are some absolute contraindications if this patient has portal vein thrombosis, encephalopathy, or biliary obstruction. This treatment is not available for those types of patients. So let's talk about the procedure itself. In the pre-procedural phase, the IR nurse needs to understand the previous history of the patient, needs to know if there's any renal disease, how well they're breathing, the COPD or asthma, if they're a diabetic, their current medications. Most importantly, within their medications, we want to know if they're on any blood thinners. because they need to stop these blood thinners 72 hours prior to the procedure, and that includes aspirin. Also, if they're on any immunosuppressant drugs, will increase their risk for infection. The labs that we check is the BMP. We do check the kidney function because they're going to be receiving contrast. We check their glucose because they're NPO, but we also check their potassium for contrast clearance and for moderate sedation clearance. The CBC, we want to check the white blood cell count and the platelets to risk for infection and to rule out any kind of risk of bleeding. Also the INR and PT. We need to check the liver function in this type of patient. That's not something that an IR nurse is normally responsible for. However, in this case, you need to know the liver function previously of this type of therapy. You need to place an IV in your patient, a working IV at least 22 gauge, and make sure this patient has been NPO. They receive pre-medications, and they all are given to counteract chemo medication reaction. All these doses vary upon each doctor, but they do receive these 4 different types. They receive an antiemetic. Usually the beginning we start with Zofran unless they're allergic, then Phenergan or Compazine. We give them steroids, Solumedrol or prednisone, histamine, blockers, and antibiotics, usually 2 of those, and Ceph or Flagyl. In the intraprocedural phase, this patient will be receiving moderate sedation for 2 reasons. They need to remain still for the imaging purposes, and we need to control their pain. The pharmacy will mix the chemo medication, and that's part of the intraprocedural nurse's responsibility to make sure that's ordered correctly. And you need to understand how to deliver that chemo drug to the IR physician sterilely. Also, in the intraprocedural phase, the nurse needs to be aware of where the cardiac monitor is placed on the patient. We're using imaging, so you need to make sure your cardiac leads are on the lateral part of the patient. And it's part of your responsibility to monitor this patient every 5 minutes after a given sedation. Some of the signs and symptoms that you will see after chemo is given to the patient would be nausea and vomiting. They might have some fatigue. They might be very anxious about this procedure. That also, moderate sedation will help with that. Most importantly, inside the procedure and post, you're going to see them having pain, because think about what we're doing. We're stopping blood flow to essentially something that's attached to their body, that tumor. Anytime you have any kind of vascular stop of blood, you're going to have extreme pain. So that's something that's very important within the procedure. Any allergic reaction, they're receiving a very heavy set of medications. So if they develop any kind of itching, rash, or shortness of breath, you need to be very aware that that could be allergic reaction. Also, what's possible inside the procedure is deep sedation. That's why you have to monitor their pulse oximetry, their CO2, their level of consciousness to make sure you don't have to give them any reversals such as Narcan or Ramazicon. Radiation safety. So as part of Oncology Nursing Society, they give these guidelines. This is your PPE that you're required to have. You're required to have gloves made of nitrile, polyurethane, or neoprene, gowns that are disposable with a solid front with long sleeves, tight cuffs, and a back closure. It needs to be low impermeability fabric, and you need to have eye and face protection for splash protection from the chemo. Everyone in the room also needs to have this, not just yourself. In the post-procedural phase, they will be admitted for 24 hours to monitor for that pain control and for those lab values, the hepatic and renal functions. You also need to chart a modified Aldrete, and you're going to be checking their vascular checks and risk for bleeding. So monitor their vitals, their femoral and pedal pulses every 15 minutes for the first hour. Some common symptoms is pain, nausea, vomiting, and fatigue. Yet if you see jaundice or critical hepatic values, severe ascites, or elevated creatinines, and if they experience any kind of renal insufficiency such as hematuria or oliguria, you need to notify the physician immediately. So one of the nurses within interventional radiology. Her name is Elaine Wimpy, and she said this about oncology nursing. A combined knowledge of both radiology nursing and oncology nursing will evolve the role of registered nurse in the interventional oncology, adding to the quality care patients experience in the IR suite. So I hope you guys really liked this presentation and thought that chemoembolization was interesting. If you have any questions, please don't hesitate to email me. I post-test. This is a post-test each student needs to take and hopefully pass with 100% after viewing this presentation. So thanks you guys, and have a good night.